Well, hi. I am Professor Dr. Nagarkar. I am a surgical oncologist. I am Managing Director and Chief of Surgical Oncology and Robotic Services at HCG Manavata Cancer Centers. Perseus, I would put it, is more of an extension of the human arms. It is an extension of laparoscopic system and the unique individual bedside units, the unique design of the Perseus instruments also make it possible to perform almost all procedures with utmost ease. It is meant for complex procedures. It is meant for procedures where human hands has its limitations, where the instruments of laparoscopy have the limitations. On Perseus, the 5mm instruments with the magnification and the dexterity which gives you, that cannot be provided on a laparoscopic platform. So one of the reasons why I opted to go for a CMR system, or the Perseus system, was I felt that it was fairly easy for my OR team, make it part of their day-to-day routine. They did not really have to struggle adapting to the Perseus. The unique design of independent 4 individual bedside units. And each of these bedside units, the footprint is very small. In fact, they actually represent the human arm. You can actually play around with the port sites, because port positions which are based on protocols, based on previous observations or experiences which are designed, the bedside is entirely different. So you could have a wonderful port positioning for a robotic hysterectomy, but you might have a patient who is at times 44 kg, and the same afternoon you are operating another patient who is 150 kg. So you can't have the same port position for these two group of patient populations. I think Perseus has that advantage, that it allows the surgeon to play around with the port positions. We have seen the digital advantage of Perseus platform into a bedside clinical care. In laparoscopic surgery, we always say that it is less painful, but the patient experiences maximum pain at the port site. The reason being, in laparoscopy, although you are trying to do it as a minimal invasive procedure, but the maximum pressure or torque is exerted at the port site. Since the surgeon and the assistant wants to perform the surgery and the patient is under anesthesia, patient cannot scream or yell back and say it's hurting me there, you tend to go on doing the movements as per your requirements to increase your surgical efficiency. A small part of digital transformation or excellence in Perseus is that it limits your unnecessary movements at the port site. Once you train the port, it's like, you mark your perimetry as to how much of pressure you can exert over there, which is going to be beneficial. So once you mark your perimetry, as a surgeon, I know, okay, this is my limit where I should be operating. And if I operate with a better efficiency over there, it translates into less torque at the port site, less trauma at the port site, and less pain at the port site.